This is Ron Stark, and welcome to Voice of the Inland Empire, your weekly adventure into the who, what, where, and why of our Southern California communities. And we have a really fascinating show today. We are joined by Chuck Kiskaden, who is the President and CEO of Health Benefits Advisors. And Chuck is going to talk to us about Obamacare, past, present, and future. For anyone that saw the presidential debate, you know that Mitt Romney, who is running for president, and our current president, Obama, who is running for re-election, have very different views of what they want to see happen to Obamacare. Mr. Romney wants to repeal it day one, and Mr. Obama, President Obama, wants 4 more years to really implement it. What does that mean to us, both individuals and businesses, come the day after election? Now, you can watch or listen to Voice of the Inland Empire in more ways than ever. We are on KVCR, our local PBS affiliate, Channel 24 in most places. We're on Charter Cable and on Smart Talk 1490 AM radio. And Charter digital customers throughout Southern California can enjoy a complete library of our shows on Charters On Demand. Or you can visit our website 24/7 for a complete listing of all the times and days our show can be seen at voiceoftheinlandempire.com. And check out kvcr.org to find out more about our show and other great KVCR programming. Don't go away. We will be right back.
Voice of the Inland Empire is brought to you by KMET Radio, Smart Talk 1490, intelligent conversation and information for the Inland Empire. Your home for Laura Ingram weekday mornings, Lakers basketball, Kings hockey, and of course, Voice of the Inland Empire, heard every Friday at noon and Saturdays at 10 a.m. Your home for intelligent conversation and information for the Inland Empire is Smart Talk 1490 KMET.
Do you own a local business and need more than 30 seconds to tell your story? Are you a member of an organization that needs an affordable, high-profile way to reach out to your community? You can air a 30-minute program on Charter Channel 31 targeting important market areas for as little as $50 per half hour. That's right, $50 per half hour. Charter will even help you promote your program. Call Jim Simpson today at Charter Media at 626-430-3504. That's 626-430-3504. Make that call today. You'll be glad you did.
It is that time of the show when we say hello to today's guest. And we are joined by a gentleman who is not a stranger to Voice of the Inland Empire. We are joined today by Chuck Kiskaden, who is President and CEO of Health Benefits Advisors. And Chuck, I've been so looking forward to having you back on the show. Thank you for joining us.
Thanks for inviting me back, Ron.
You know, last time you were on, we talked about kind of health care in general and a lot of what ifs if Obamacare passed. Well, obviously it has passed, but now everyone's talking a lot of what ifs depending on who wins our presidential race. And I'm looking forward to kind of having a discussion about that. But before we start, share with our viewers and listeners who maybe didn't watch the last time you were on a little bit about your background and your business.
Thank you, Ron. My company, Health Benefits Advisors, we're insurance brokers for employer groups. My background, I've been on both sides of the healthcare spectrum as it relates to work for insurance carriers and executive positions with Kaiser Permanente, Blue Shield, Blue Cross, a number of companies, and also worked on the employer side with an employer purchasing coalition. And that company, Pacific Business Group on Health, was the organization that initially ran the California HIPIC, which was the small group insurance pool that California used to have, and is a perfect mirror image almost of exactly what the insurance exchanges that employers are going to see starting in January 2014. So I've had a lot of hands-on experience with what the insurance exchanges are like. That's my background. I've been doing this for a number of years.
Oh, what? You're not going to admit how many?
A number of years.
Good answer.
Right.
And that's why we wanted to have you on the show, because you've got experience from both the benefits providing side of the business and the employer side. Because everyone I talk to in healthcare and health-related industries, what you see floating above their heads are not light bulbs, they're giant question marks. And let's kind of do kind of a repeat of what we talked about last time.
Sure.
Obamacare is in place. What are some of the changes that have already occurred within the healthcare system, and what are some of the ones that are on the slate to still happen?
Some of the really exciting things have happened already, for sure. The first thing that became obvious to employers and employees and individuals was the fact that for the companies, they now have the ability to cover the children to age 26. That started right off the bat.
And that can be huge for a lot of families.
That can be huge. And for most of the employers that have been making benefit decisions, they now have available to their employees the coverage of wellness programs at no cost. So when a woman goes in for her annual checkup, or a man, when they present themselves for an annual physical and annual checkup, even if you have a $2,000 deductible insurance product, there's no cost for wellness programs. That's in place already. So those are some of the positive things that are in place. For an individual that wants to buy insurance, the real change isn't until January 2014. That's when the insurance companies cannot turn anybody down with a pre-existing condition. But the government, as part of this law, created a high-risk pool, and California already has one in place. So if you currently don't have insurance, haven't been insured for 6 months, you can go to the state and you can have immediate access to these high-risk pools with fairly competitive pricing, and it won't turn you down regardless of your medical condition.
And that's already in place?
That's already in place. That started a year ago.
I was not. As an offshoot of Obamacare, or just separate from that?
As an offshoot of Obamacare, as part of the law. The government did not want people that currently have pre-existing conditions to be excluded from getting insurance right now, so they funded these high-risk pools that will be in place until January of 2014.
And then they'll transition over.
That's correct.
But how are they keeping the prices competitive? Because the insurance companies certainly don't want to keep them competitive.
Well, they're subsidized by the government to some extent as far as the keeping them competitive. The government had about a $5 billion fund, and they created these high-risk pools in every state. So they're within 110% of normal competitive rates.
Wow. Okay. Because that's a problem. Because, you know, for example, myself, I own my own business, self-employed. I'm not part of a group plan, and what I'm paying for my own individual insurance is easily 2 to 3 times what I'd be paying if I was part of a larger group plan.
It's certainly greater than part of a large group plan, but probably not 2 to 3 times, but you're definitely paying more. The group plans normally have better benefits as well as competitive rates.
And it depends what the business offset is as well.
Correct.
If the company's picking up part of the cost.
Oh, absolutely. That's for sure. The companies have to pick up at least 50% of the price, or the insurance carriers won't write a group plan in California.
Right. So, you know, I personally, am not in favor of all of the elements of Obamacare, and I've gone on record as saying that. But I'm also the first person to say that our existing health care program in this country was terribly flawed and broken and needs improvement. So this is certainly, there's certainly some very good aspects of Obamacare. But one of the things we keep hearing about, and I'm going to ask you if it's a myth or fact, is, I actually saw a bumper sticker and it said, if you think health care is expensive now, wait until it's free, which made me chuckle.
I'll bet it does.
So,
right.
I know initially we were told that, the increased costs were going to be offset by savings, but most people really are not feeling warm and fuzzy about that. Fact or fiction?
Mostly fiction. There's certainly the way that the law was designed, and one other improvement that is currently in place is for people on Medicare. The law immediately started getting rid of the donut hole for prescription drugs, so that's a real positive for seniors as well as other things. It certainly is fiction. The cost of health care has only gone up about 1 to 1.5% as a result of the parts of the law that were put in place already, covering children to 26.
But the more expensive parts are yet to come.
The more expensive parts, yes, because the funding of the insurance exchanges which have to be set up, the penalties that employers need to pay if they don't have insurance starting in 2014. There are a number of other ways, though, that the funding is taking place. As of this year, for example, a person that has invested money, and you say you have a house that you're going to sell, starting in January of 2013, you'll pay a 3.8% penalty, tax, on the investment income. That is all part of the Obamacare legislation. There's other taxes. If you go in to get you like going into the salons to get your tan instead of going to the beach, there's a 10% tax now on those tanning salons because they think they may lead to some cancerous problems or whatever. So there's a lot of different ways. The insurance carriers are going to have to be chipping in some money based on their volume of membership, and the pharmacy companies are going to have to start chipping in some money down the road to help pay for part of this. The one thing that has people concerned is what's happening to Medicare. And you hear during this, all the debate and discussions is they're taking $800 million, or excuse me, $800 billion out of Medicare.
Yeah, well, that was talked about in the debate a lot.
That was talked about in the debate. And the both parties have a different way to approach that. But there are subsidies for parts of Medicare that money comes out of, no longer subsidizing insurance companies. So there's a lot of discussion in this area.
Well, we're running out of time for this segment. We're going to take a break. And when we come back, I want to kind of use what you were just talking about as a springboard. You know, we all watched the debates, or at least most of us did. And let's talk about what Obamacare may look like after November. Because both of our president and the presidential candidate, Obama and Romney, both have very, very different views of what should happen to Obamacare. And I think a lot of people are wondering what those viewpoints might lead to. I know a lot in the business community are. So don't go away. The best part of this conversation is yet to come.